The School of Health and Applied Human Sciences is starting a respiratory therapy program. It will be the first entry into practice bachelor's degree in North Carolina. We are a part of the College of Health and Human Services, located in Veterans Hall. You may be wondering, what is respiratory therapy? We are an allied health profession that works directly with physicians and alongside nurses, among other healthcare professionals. Most of us work in hospitals. Some of us work in rehabilitation facilities, cardiac or pulmonary. Others may work in diagnostic labs like sleep medicine or pulmonary function testing. Outside of that, we may work in home healthcare environments, among other options that respiratory therapists have at their disposal. What do respiratory therapists do? We assess, treat, and care for patients with breathing disorders. Naturally, this would include patients who experience lung disease or complications of the lung, but that also includes patients who have heart disease or cardiac arrhythmias. And there are times we treat patients who have other conditions that impact the chemistry of the blood, that impact or influence breathing. According to the Bureau of Labor and Statistics, there are approximately 130,000 respiratory therapists that work across the country. The mean annual wage is approximately $62,000, and the median annual salary or hourly rate is $28 an hour. If you're considering applying for this program, please go to our program webpage. We have an admissions procedure that includes a 3-step process. Step 1, just make sure you get all your ducks in a row. Step 2, apply. And Step 3, we'll have a final interview to make sure that you understand what the profession is all about. On the admissions page for the Entry into Practice program, you'll find a scoring sheet. It's a PDF that you can download and take a look at. It's going to help us rank candidates that apply to the program. It's going to factor in points associated with your overall GPA and the grades earned within the prerequisite courses listed. Additional points will be earned for candidates who've completed the majority of their university studies course requirements. And there are points also associated with the essay and interview, which are part of the application process. The student experience is important to me, and that's delivered through this academic home. And that starts with the curriculum. You're going to value the things that you learn over a short amount of time, and it'll take you far within your profession and beyond. The co-curricular activities are the things you're going to remember probably most. Those are the partnerships within the college, within the community that make your student experience rich. We're going to try and do that through student club organizations or whatever service events that occur. The last is mentorship, and this is where we support one another, right? Students within a cohort can support one another, or between cohorts where seniors are working with juniors and trying to help them be successful. Of course, you'll have mentorship between faculty and students as well, but they are all important. I encourage you to go to our program website for more information. Remember, this is the Respiratory Therapy Program, Entry into Practice. We do have liaisons within the Student Success Center who are readily available to answer your questions. Also, if you're interested in applying now, go ahead and scan the QR code and it'll take you right to the application. Thank you.